Hi, I'm Dr. Jill Sullivan. I'm a licensed clinical psychologist, and I have worked with pregnant and postpartum women for over 15 years. I am also an assistant clinical professor in the Department of Psychiatry and Behavioral Sciences at Northwestern University's Feinberg School of Medicine. I specialize in cognitive behavioral therapy, or CBT. CBT is a treatment approach that focuses on the link between thoughts, behavior, physical reactions, and emotions. Research has shown that people who use these techniques improve more rapidly and continue to improve even after therapy ends. I have worked with women who are struggling with family planning, pregnancy loss, mood management during pregnancy, postpartum adjustment, and the transition to motherhood. I also work with psychiatrists, OBGYNs, and other physicians to meet my patients' healthcare needs in a comprehensive way. This is particularly important when managing the medical, biological, and psychological aspects of pregnancy and the postpartum period. While some medical practices provide this type of integrated medicine, many do not, and the ones that do may not be covered by your insurance or might not have openings to suit your schedule. I created this series for all of the clients I cannot personally see. While there are many women who have contributed to this project by trusting me with their care, there is one woman, whom I will call Emma, who particularly inspired this series. When I first met Emma, she was 10 weeks postpartum and struggling with severe anxiety. She lived in an area with no mental health professionals who specialized in women's health. Fortunately, her aunt lived in Chicago and had an OBGYN who recommended me. Emma's husband was able to arrange to work remotely, and the new family came to Chicago for the summer so Emma could get the help she needed. Emma had experienced symptoms of obsessive-compulsive disorder, or OCD, during her childhood, but was not diagnosed until her senior year of college. Because mental health resources were very limited in her state, she managed her symptoms mainly with medications prescribed by her primary care physician rather than a psychiatrist. She stopped taking her medications when she learned that she was pregnant. Like many women, she decided that it was better to be safe than sorry. When her OBGYN asked her which medication she was currently taking, she said none, because she had discontinued them. She didn't think that her OBGYN was the kind of doctor that you talk to about anxiety, so he was unaware of her history. Emma had been successfully treated with medication for so long that she didn't recognize the symptoms of anxiety when they returned. The physical symptoms, which included rapid heart rate, restlessness, decreased attention, and poor sleep, felt so punishing that Emma concluded that she must have done something bad. She began to review first her past and then her recent experiences and couldn't find anything. She went over and over her actions and decisions. There was no one to explain that no matter how punishing anxiety feels, it does not mean that you have done something wrong. So Emma concluded that she must be making the wrong decisions every day about what to eat, what to wear, where to go. Decision-making became so difficult that she took a leave of absence from work. Emma lost her routine. She no longer had the sense of skillfulness and accomplishment that work provided, and she had too much time to think. Decisions about what to wear became so difficult that she avoided seeing other people and soon had difficulty leaving the house. Decisions about what to eat were so difficult, she settled on a repetitive schedule of meals, which was so limited that her doctor became concerned that she wasn't gaining enough weight. She found it so difficult to make decisions about what to buy for the baby or what to name her that she gave those responsibilities over to her mother and her husband. She began to worry that she didn't love her daughter enough and wouldn't be a good mother. Although she assumed that she would feel better once the baby arrived, she was so depleted by anxiety and lacking in confidence that she worried about being left alone with her baby and was unable to be separated from her husband. All of this was preventable. Early intervention and basic understanding of what anxiety is and how it can spiral, and cognitive behavioral therapy could have prevented Emma from developing anxiety as severe as hers became. We don't all have access to the care that we need, but almost all of us have access to the internet, and almost all of us do online research when we begin to suspect that we might need medical attention. We feel safer in the privacy of our own homes, and we can feel embarrassed or intimidated asking for help. For those reasons, and because I don't want any woman to suffer as Emma suffered, I decided to create this series of videos. No one is born with the ability to snap out of anxiety or just relax. Managing anxiety is a skill that can be learned, and this series will help you do that. Let's begin. Pregnancy can be wonderful. Perhaps this is your first pregnancy and you became pregnant right away. Maybe it took longer. Maybe you had a miscarriage before this pregnancy. Maybe you endured months of fertility treatment. Maybe you weren't trying and were caught off guard by the positive pregnancy test. However you became pregnant and whatever you went through along the way, you are pregnant now, and you may feel that you are expected to be happy. Many of my patients describe themselves as bad with change, and pregnancy comes with a lot of change. Your relationship, housing, job, responsibilities, and position within your family all might change. Your body will certainly change, and pregnancy can be physically uncomfortable. Many women devote a great deal of time and energy to thinking about their nutrition, health, pregnancy symptoms, appointments, planning showers and the nursery, researching baby equipment, and wondering about the baby's gender and development. Even if you aren't feeling anxious, there is a lot to think about during pregnancy. And pregnancy is often accompanied by some worry. Once you decided to start trying, you likely experienced at least some worry about conceiving. Maybe you know people who had difficulty conceiving or required medical assistance to conceive, and wondered if the same might happen to you. You may have worried about your diet, alcohol intake, medications, or your overall health. That worry might have prompted you to stop drinking, take folic acid, and avoid certain foods. You might have worried about your or your partner's medical histories and ethnic backgrounds. Perhaps you had some initial genetic screening to address your worries about cystic fibrosis, Tay-Sachs, or other genetic problems. Once you became pregnant, you may have developed worries about maintaining the pregnancy. What if you had an ectopic pregnancy? Perhaps you consulted a list of symptoms of ectopic pregnancy to reassure yourself. You may have worried, or may still be worried, about miscarrying. Maybe you scan your body to see whether you still feel pregnant. Still nauseous? Breast still tender? Any spotting? No? Good. You can exhale. As you wait to see your doctor for the first time, you might worry about whether or not they'll find a heartbeat. Then, you might move on to other worries about the fetus. What are the odds of the child having Down syndrome? What about spina bifida? Will the heart and lungs develop properly? Should we do genetic testing? What are the odds of miscarrying if I choose to have an amnio or CVS? Will the needle hit the baby? The longer you're pregnant, the more you might worry about the changes ahead. Will you and your partner be good parents? What will you do about work? What will you do about childcare? Can you afford a baby? Will your relationships change? Will you love your baby enough? At some point, you will worry about labor and delivery. How badly will it hurt? Will you be able to manage it? Should you have an epidural? What effects will that have on the baby? Will people judge you if you decide to have one? What if you need a C-section? What if you don't make it to the hospital in time? What if your labor stops progressing and they send you home? What if your favorite doctor isn't on that night? You may worry about what will happen after delivery. Will the baby have all of his fingers and toes? Will she pass the APGAR test? Will we be successful at breastfeeding? What if he doesn't latch? What if my milk doesn't come in? What if I don't want to try? Will people judge me if I prefer to use bottles? What will happen when we get the baby home? What if he doesn't sleep? Is it cold and flu season? Did that person wash their hands before they picked him up? What if I don't attach to the baby? What if I develop postpartum depression? These are common concerns during pregnancy, and you probably asked yourself at least some of these questions. Some may have passed quickly, while some may have lingered. Others you might not be able to get out of your mind. These questions may have gone from the level of concern to worry, maybe even obsession. In short, you are now experiencing anxiety. Anxiety has 4 main elements: emotional, physical, cognitive, and behavioral. Emotional aspects of anxiety include those single words that describe your feelings: nervous, anxious, panicky. Physical aspects of anxiety include experiences within your body: changes in your heart rate, changes in your respiration or shortness of breath, muscle tension, abdominal distress, fluctuations in attention and concentration, fatigue, difficulty sleeping, and so on. Cognitions include anything that goes through your mind: thoughts, worries that you may or may not share with anyone else, memories, going over things you wish you had done differently, fantasies or daydreams about what might happen in the future. Behaviors associated with anxiety usually include avoidance, a desire to escape or flee, or seeking reassurance. Think about anxiety like an old-fashioned thermometer. At the bottom of the thermometer is a certain amount of mercury, which represents whatever amount of anxiety you were born with. While we know that anxiety runs in families and that you can be born with a biological predisposition to anxiety, people don't express their anxiety in the same ways. Some might have difficulty with heights. Some might have panic attacks, while others might be somewhat obsessive. You might also be born with anxious traits. Traits are personality characteristics that are present over long periods of time. Anxious traits include things like the tendency to be achievement-oriented, conscientious, easily stressed, perfectionistic, sensitive to criticism, and risk-averse. If you have anxiety disorders within your family or have a lot of anxious traits, then it is possible that you were born with a little more anxiety than the next girl. Add to that the anxiety brought on by life stressors. If you were born with a greater predisposition to anxiety, you might experience more anxiety during times of transition or stress. And pregnancy is certainly a time of transition. Other stressors include family stress, work stress, relational stress, financial stress, and health-related stress. The more stressors you experience, the higher your thermometer climbs, and the closer you come to the boiling point. The boiling point is where you begin to experience symptoms of anxiety, like those I described earlier. If your symptoms are severe and interfere with your day-to-day life, making it difficult for you to function at home, at work, or in your social relationships, you may be diagnosed with an anxiety disorder. We will talk more about specific anxiety disorders in another segment. For now, it is important for you to recognize that you could benefit from some relief. How will you know whether you might benefit from the information and techniques presented in this series? Here are some questions to ask yourself. Would you describe your anxiety as intense? Does your anxiety come and go like gentle waves, or are you feeling anxious most of the days of the week, or throughout most of the day? Are the strategies you typically use to manage your anxiety not working as effectively? Do you feel like you have been trying all of the things that you usually try, and it's not enough? Have your family or friends noticed your anxiety? Have they expressed concern? Does your anxiety interfere with your enjoyment of the pregnancy? Is it harder for you to work or be productive? Are you distracted by your anxiety much of the time? Have you experienced any medical complications that your doctor believes might be stress-related? Do you worry that your anxiety is not good for your baby? If you answered no to all of these questions, you might not need this series, although almost everyone benefits from learning strategies to turn off anxiety as quickly as possible. If your goal is to be as comfortable as possible and prevent noisy worries from intruding on your pregnancy, then you will probably benefit from these interventions. As I tell the women I work with, there is not a whole lot of difference between 82 and 78 degrees, but we feel better when we're in the 70s. Sometimes just 4 degrees makes a huge difference. If you feel like you need more strategies or a broader range of strategies, this information will help you. If you answered yes to some or most of the questions I asked here, and especially if your doctor has suggested that you would benefit from addressing your anxiety, I hope you will continue. Why are identification and intervention important? Realizing that I am quite possibly about to make you more anxious, it is important to understand why you need to invest your time and resources in learning how to lower your anxiety. First, emotional stress during pregnancy has been linked to premature birth and low birth weight. Second, anxiety during pregnancy or perinatal anxiety increases your risk for postpartum depression. Third, excessively high anxiety can interfere with your relationship with your doctor, making it difficult for them to treat you. It can also interfere with other relationships, causing you to feel isolated or your friends and family to feel burned out before your child has even arrived. Lack of social support is a prominent risk factor for postpartum depression. Being as healthy as possible is always important, and heightened states of anxiety can interfere with nutrition, exercise, and sleep, which are important components of prenatal care. And most importantly, you don't have to suffer. Interventions for anxiety include medication, alternative medicine like acupuncture, therapy, and self-help. As I said at the beginning of the video, I specialize in cognitive behavioral therapy, or CBT. To understand the CBT approach, imagine a large circle that contains anything that is outside of you and that might influence your anxiety. Things like events, places, and life experiences that make you anxious or contribute to your anxiety. Remember that the 4 inner circles represent different aspects of your anxious response. Medication and alternative medicine mainly target the mood and physical reaction circles. Medication essentially creates a ceiling and a floor. If your anxiety begins to climb, there is a ceiling you bump into before you spiral into the stratosphere. If your mood begins to dip, there's a floor that catches you before you fall into the abyss. Medications can help with things like regulating brain chemistry or improving sleep and appetite. But some women are concerned about using medication during pregnancy and prefer behavioral strategies. CBT focuses mainly on the cognitive and behavioral circles, teaching techniques that help you understand anxiety and change the thought patterns that create or maintain your anxiety. We teach relaxation strategies to reduce physical tension and anxiety, and emphasize that while anxiety is uncomfortable, it is not unmanageable. Behaviors like avoidance, seeking reassurance, and safety strategies, which are very common responses, may reduce your anxiety temporarily, but will actually make it worse in the long run. In CBT, we encourage you to confront the things that you fear, whether it's a fear of a particular symptom, situation, or triggers, while using CBT techniques to reduce your anxiety. Learning to think differently increases your knowledge of ways to reduce anxiety, and using techniques to reduce the interference of your anxiety in your day-to-day activities can make you feel less anxious, more confident, and happier. One of the most difficult things about my job is telling a woman that I am not able to take her on as a client. There is only one of me, and as a mother of two myself, my time is limited. While I might be able to recommend another therapist, it is difficult to find providers with similar expertise. I have treated clients from other states because they were not able to find a local provider. It can be difficult to find someone who accepts your insurance, or to make time in your schedule for appointments. Pregnancy is challenging enough, and time is of the essence because you want to do what is best for you and your baby. At the urging of women who have worked with me in the past, I have put together this series. It covers the information and primary techniques that I would provide to you if I could meet with you personally. Here's an overview of the techniques that I cover in this series. Tension reduction techniques, relaxation training, improving self-care, identifying automatic thoughts and cognitive distortions, coping statements, thought-stopping and distraction techniques, rational response techniques, do you have an anxiety disorder, when to seek outside help. If you are interested in learning more, please visit www.anxietyfreepregnancy.com and click on the link to purchase a series.